One of the hardest things to do is to attach orthodontic bracket to a crown, a manufactured crown, may it be a PFM or a zirconia or whatever have you. When a crown is placed somewhere, this is how the crown material is, including the margins. And a lot of people try to roughen up the facial surface of a molar or a premolar, and then they try to do silination and etchant with hydrofluoric acid and silination and adhesive, and the brackets invariably come off. Today I did a case of a zirconia patient with zirconia crowns on a couple of teeth, lower first molars, and I needed to attach the brackets. So this is what I did. I took an inverted cone burr. Inverted cone burr kind of looks like this, but a diamond one, not carbide. Carbide itself will be destroyed by the zirconia itself. So I took this, and exactly where the bracket was going to be, I made kind of like a class 5 prep on the facial surface, kind of like right here, if you would. So I went with the burr all the way to the dentin, and here, once I got into the dentin, I used the inverted cone part and I made physical retention. So when you look at it, it's kind of like a class 5 but with physical retention. And then I acid etched this part of the dentin, applied the adhesive to it, and put in the ortho bracket cement all the way on the inside, filled it up. Once it was done, I took the ortho bracket and I placed the bracket up on top. And that's how the ortho bracket went. And here, if you look at it, the ortho bracket went like this, and of course it has a hook for attachment. And I know that the composite itself was stuck physically and chemically to the dentin inside. It cannot stick to the zirconia crown, and this physical retention composite that was coming out is now attached to the composite, which is a resin-based cement that is used for orthodontic brackets to stick with it. And then we have good anchorage. Now, having done this, it is better than roughing up the whole surface or destroying the crown or redoing the crown. And since it was done on the lower first molar, once we remove the bracket, I can do almost a color shade matching composite in this area, and that's fine. If the patient wants, of course you can do a crown again, but this way we salvage the crown, we keep the crown there, and since it's in the buccal vestibule and a lower molar, it doesn't show up. Having said that, in case I'm doing endos on somebody and they need crowns and they also need ortho, then what I do is I just do post build-up and a crown build-up in composite, and I don't do a crown till ortho treatment is finished. That way, once the treatment is finished, then we can do very nice looking crowns, and then we don't have to cut the tooth at all or the crown itself later on.